In a country where fizzy drinks are often cheaper than clean water, health experts say Nigeria is facing a growing crisis, one spoonful of sugar at a time. At a media roundtable in Abuja, the Corporate Accountability and Public Participation Africa Cappa called on the federal government to increase the sugar-sweetened beverage SSB tax from 10 naira to 130 naira per litre. Cappa's executive director Akimbode Oluwafemi said the current levy is far too low to curb the rising wave of non-communicable diseases like diabetes, stroke, and heart conditions, which now account for 1 in 3 deaths across the country. Describing the situation as both a health and economic emergency, Oluwafemi warned that Nigeria is becoming a dumping ground for unregulated sugary drinks and urged the government to introduce clearer front-of-pack labeling. He also dismissed claims that a tax hike would hurt jobs, citing international examples where stronger SSB tax helped reduce consumptions without damaging economies.
Beyond health concerns, Nigeria is missing out in valuable revenue. A stronger and well-structured SSB tax has the potential to generate over 200 billion each year. This one should directly support the goal of increasing healthcare in Nigeria, financing, including the basic health care provision for National Health Insurance Authority, and even school feeding programs, helping to build a healthier and more equitable society. Other countries have shown what is possible when government take bold action. Many, like South Africa, Mexico, United Kingdom, have raised SSB significantly, and in each case, consumption declined. But contrary to what the industry would tell us, jobs and revenue never decline. Nigeria must follow suit. The moment to act is now.
Other speakers lent their voices to the call for government action so as to save lives.
We are dying on installments. The day you drink the last one, you just cry. So there is need for us to be cautious about this. And a country that loves its people, we take it very seriously to think about the current tax on SSB. And why I'm saying this is because the current tax on SSB is very low. It's insignificant to the extent that I remember when we were young, especially in the high school days, most of our money, they will give us, this condensed milk, processed food. We still be buying drinks because it is affordable, not knowing that what we are taking is killing us.
And it's the fact that sweetened beverage companies, not commonly known as big soda, they engage in high-stakes battle, to protect their profits at the cost of public health. They sponsor sporting events. They try to skew scientific research and data. They even try to manipulate tax policies to favor their interests. And they all together work to derail the SSB tax agenda. And health advocates around the globe are beginning to recognize this threat and this trend and are now urging governments to take a stand.
So we are hoping that the government don't just look towards implementing it also, but also executing it on the long run.
Through advertisements, they've changed and modified our lifestyles, and we think that these things are healthy, but they are not. They are killing us. As Prof said, they are killing us instrumentally. And not only that, we have also transited in the way that we live our lives from lifestyles that were physically active 20, 30 years ago to lifestyles that promote a lot of inactivity.